So what to do if you experience nausea in the following days or weeks after the bariatric procedure? First, let's talk about the occasional to persistent nausea that's not leading to any vomiting or dry heaving. First of all, you have to hydrate. It's very important to try to have at least around 48 ounces of fluid a day, or 1.5 liters. That in most patients is enough to keep you, if not well hydrated, to keep your hydration at least at a base so that you don't get dehydrated. Remember to follow your drinking and eating instructions carefully. You should not go ahead and jump to a next stage of the diet if you haven't completed the previous one. And this is a very important thing. Remember to slow down and be consistent with your fluid intake. If you take big gulps of fluid or if you drink too fast, this will trigger a lot of pressure inside your stomach. It can trigger reflux and it can trigger nausea. Remember that your stomach at this point is still swollen, and it can generate a lot of problems with its emptying and again with the pressure that it handles inside. So it's like having a stomach overfilled, multiply exponentially if you drink too fast, and it leads to that pressure. If a specific beverage or food item leads to that symptom, or when you went ahead and followed your diet plan and went to the next consistency level of the diet, whether it's shakes, purees, or even soft solid food, remember to take a step back, and you may be required to stay a few weeks on that previous diet that you tolerate before taking the step again. The stomach generates a lot of inflammation in the first 1.5 to 2 months after the surgery, and it's very rigid. So picture a plumbing pipe and things or solid items trying to make its way down, especially when it's narrow, when it's a long funnel. So this is the reason why most people experience sometimes difficulty moving to a next stage of consistency. But you also have to be assured that this is something that'll get a lot better as time goes by. Why? Because the inflammation eventually will subside, which takes a couple of months. And then the scarring process within the stomach that doesn't allow any distension initially will later allow some compliance. And this is usually when the stomach starts to get a lot better. This is why you'll start off eating a very tiny amount of food, and as time goes by, the amounts will get gradually a little bit bigger, and they're going to get to the point where they're not going to move. But this is a gradual process, and it takes close to a year to happen. But initially, pay good attention to the next consistency level, have trouble, take a step back. Also, if you have only nausea and you have medications that you normally take for this type of issue, and they work for you, such as Phenergan, such as a Dramamine-based medication, such as Zofran, remember that you can take them. Just make sure you let us know. And large pills and tablets, when you're nauseous, should be cut, crushed, if they're not extended release. And remember, one of the most important things of all you should take from this message is that if the nausea that you have leads to dry heaving or vomiting, and especially if it's persistent or not persistent, this is an emergency. You have to contact the physicians at OCC. This is something that cannot wait, and it's something that you should pay close attention to. Sometimes we get patients that give us a call because they had one episode of something getting stuck and vomiting when they move to a next consistency meal. And we're always happy that they do let us know, because we can reassure them that everything's fine. But when this symptom becomes persistent and it's happening with every single bite or every single beverage that they take, this is something that's not right and should not be happening at this moment. So for further assistance, please stop watching this video and contact our OCC medical staff. Thank you.